We literally just went through a huge rebranding process.
It's like one of those things that, we can't change the name. That's never going to work, and people are going to get mad.
Any change isn't necessarily easy for a business or a community to accept.
Every time I turned around, there was a new focus group. I mean, there were focus groups about the focus groups from the way it looked. But the result of it was that at the end of the day, it ended up being easy.
I guess we've been discussing this rebrand for about the past 4 years.
We were called Paris Community Hospital. That was the name. Then we added Family Medical Center when we added on our clinics.
Rather than come up with a new name or anything like that, they just kind of pushed the two names together and put a backslash in the middle.
We are located in Paris, Illinois. Paris is the county seat for Edgar County.
We definitely consider our primary service area the county at large, and then the adjacent counties. And while there is a strong presence in Paris proper, there's also so much area there that isn't Paris at all. And so that's really what we were trying to communicate. The rebrand had about 5 drivers behind it. Maybe the largest was the growth factor. We've grown in people, we've grown in brick and mortar, and we've grown in services like recruiting an endocrinologist.
We're adding a second general surgeon.
We have recently started an ambulance service.
We have a podiatrist.
We have developed our pain management clinic, and then tons and tons of little procedure type things.
So the idea was to shape this such that we could identify a lot of the things that we do now that we did not identify in the past. And so the idea was, well, let's try a rebrand. One of the things that's interesting about the rebrand is that it didn't come top down. This came up from people inside who were dedicated to the community and to the organization. We had a lot of discussion on what the name should be, whether Paris had to be in it, didn't have to be in it.
Naming conventions are usually a large donor or geographical. Our outlying communities that we were trying to reach, they felt a little isolated. They didn't want the name Paris on everything that happens in their community, but that meant we were ending up with generic words. It got really hard at the end, and finally I said, we're gonna have to grow into whatever we pick.
It's like naming a baby. Everyone will get used to it. The institution will define what the name means, and not the other way around.
And that analogy seemed to trigger it.
Once you got past that, it was really an interesting intellectual exercise because people were free associating, well, what does this name mean?
And I think we went through probably 80-ish names before we got to Horizon Health.
Horizon Health was one of my choices when it came down to the final few, so I was glad that it was the one that got chosen.
Horizon Health really allowed us to define our company's structure for future growth into other communities.
As long as we're growing to do the right thing for the people that we serve, to meet the needs of the community, that's our long-term vision. And the name Horizon Health, I think, will help get us there.